Good afternoon. Welcome to day 292 at the St. Clair County EMA office, where I'm joined by Chairman Kern and Assistant Director Brian Whitaker. Today we got a little change of the program. Chairman, we got a couple of doctors with us. It's going to take a few questions from us.
Yeah, Herb, I think we're really happy today. We're joined by two doctors from St. Elizabeth's Hospital, Dr. Peyton McGowan, who is the hospitalist medical director, and Dr. Jeff Schaefer, the emergency room medical director, both of whom we saw I guess a couple weeks ago now, getting vaccinations, and we're going to get an update and then a little conversation from each of them. We're going to start with Dr. McGowan, I think, today. Doctor, how are you?
I'm good. How are you?
Good. I'm doing fine. So last time we saw you, you were getting an injection of the new vaccine, and how's everything going? Did you have any side effects or anything, or was it all smooth?
No, everything went well. Really no pain. Except the flu shot was actually I was more sore after that. I didn't have any issues, and everything went really well.
So now you have a certain amount of immunity, is that right?
Yeah, we don't know exactly how much immunity you have from the first shot, but next week I'll get my second dose, and then should be good to go.
Well, does it make you feel stronger and more powerful?
I wouldn't say stronger. It's just that added layer of protection, knowing that you have that as a backup. We're still obviously using all the appropriate PPE and taking all the precautions, but it's just kind of that sigh of relief in the back of your mind, an extra layer of protection.
It has to be a stress reliever, certainly with the position that you're in. So I'm going to ask Dr. Schaefer the same question. Jeff, how's your experience been with the vaccination?
Oh, it's been great. I had no symptoms whatsoever. Wasn't even sore. So, like Peyton said, it's really a relief to know that we're even more protected from this virus after receiving it. Next week, I'll get my second shot as well, and I'm looking forward to it.
Well, that's good. And do you have any idea the rest of the hospital personnel, have they been able to take advantage of this and pretty well getting enough vaccine to take care of the hospital?
Yes, the vast majority of people employees at the hospital and providers have been vaccinated, and I think everyone has done quite well.
And things have been going smoothly. I know we're gearing up in the county to be able to start vaccinating the general public whenever those vaccinations come. So hopefully we'll be able to use the knowledge that you've gained from how to disseminate the vaccinations once we get those in hand. So maybe we'll go back to Dr. McGowan. What do you see? We noticed the COVID-19 related patients in the hospitals right now. We've got a record number today in St. Clair County of 122 and regionally 203. We're seeing a big increase in those numbers. Are you seeing a stretching of capacities?
We are. We're definitely trending up the last few weeks. I think a lot of it has to do with people getting together during the holidays. So just like we've been urging everyone for the last 9 months, we're urging you to stay home, minimize get-togethers on the holidays. I know that Christmas is over, but New Year's Eve is tomorrow. So if you can just stay home and celebrate this year at home with your immediate family and not go to large gatherings, we really don't want to see this continue to rise. We would really like for everything to start trending down again, and especially now that we have the vaccine for our healthcare workers and coming out hopefully soon to the community, we can really nip this in the bud and not have another spike.
Dr. Schaefer, any specific requests from you along the same line?
So I would echo Dr. McGowan's statement. We're really optimistic with the vaccine being right around the corner for the general public to put an end to this pandemic. Now is not the time for large gatherings. You should keep your circle small and stay well so that you can get the vaccine just as soon as possible and we can all return to a sense of normalcy.
When we started this pandemic 292 days ago, it was mainly older people that were entering the hospital. we are now seeing the numbers of people who are getting COVID that are younger really escalate. Are you seeing the same thing for the hospitalizations?
Definitely. While it is true that the vast majority of the patients that have a bad outcome are older, that is definitely not exclusive. We do see young, healthy patients that come in with devastating illness. And even the ones that are not critically ill can be left with debilitating symptoms for weeks. You're out of work for a month or better. This is not uncommon at all. And then, of course, you have to worry about your loved ones that you would inadvertently give the virus to that may not be in the best of health.
So the vaccination is not a treatment, right? I mean, there's some people that think, well, I can go out and go to Christmas parties because the vaccination is now available. Those two things really don't equate, correct?
That's correct. There are no miracle treatments for COVID-19. We have medications that will assist us, but none of them are reliable enough that you can feel safe to go out to large gatherings and perhaps contract the virus, get ill, and know that you can come in for a quote-unquote cure. The vaccine is preventative, which is what's so important for the population to be cautious and stay well in time to get this vaccine, allow it to do its work.
So, Dr. McGowan, what are you seeing coming in? Are you seeing the same thing with the age ranges? Any surprises that are really kind of coming to light as we're into this nearly 300 days?
I mean, just to echo what Dr. Schaefer said, we're seeing patients of all ages now. In the beginning, I think the elderly were more susceptible, so those are the people that we saw more of. But now it's getting into more young and healthy people. I know personally, friends and family that have been affected that were previously young and healthy. So I see it in my patients and in my personal life as well. And so, as promising as the vaccine is, we can't help the people that have already been affected. This is to prevent everyone who has not yet had the virus. As Dr. Schaefer said, it's not a cure. And we need to make sure that the majority of people in the community get it before we can see an end to the pandemic.
So I would think that you have to be worn out, certainly Dr. Schaefer and the staff, the nurses, and everyone working at the hospital. How is everyone holding up? I mean, we've got to sustain this a while longer, certainly.
We're definitely tired, but the vaccine was a real morale boost. It was a really great day when those came in. Sorry, I get a little bit emotional about it, but it was definitely a morale boost, and we're seeing a lot of positivity now in frontline workers for sure.
Great. Well, any closing words from either you or Dr. Schaefer? Request of the public how perhaps we can help you on the front line to maintain your ability to do great work on the front line?
See, these daily updates are amazing. Keep getting the word out there. Stay at home, stay safe. We're close to the end. If we can just hold out until we have more available vaccines, I think that we're near the end. So hang in there.
Great. Dr. Schaefer?
I would just caution everyone encourage everyone, as I have already said, keep your circle small for now. Stay well so that you and your loved ones that have underlying illnesses can get this vaccine as soon as possible and hopefully avoid the fate that some of our previous patients have seen this year.
Well, we sure hope to see you soon. Herb, you have anything?
I just appreciate the job that the doctors do and taking time to come on here and share their experiences with the vaccine. And I think you answer a lot of questions that we get here on a daily basis from our citizens. And I know, speaking for Team St. Clair, we appreciate everything you doctors and the frontline workers have been doing for the last 292 days. And we're all in this together. Appreciate your help.
You're our heroes, and we sure appreciate your service to the community. Thank you both very much. We'll see you soon.
Well, and we said that a couple of special guests, and they don't get much special than two doctors that have been here and are fighting this hard fight. We'll go to Brian now with our numbers for today. Brian?
Okay, thank you. For St. Clair County, we have tested 205,878 which is an increase of 1,491 since yesterday. Positive cases are 20,662, which is an increase of 213 cases since yesterday. And those are males and females under 1 up to their 90s. Our daily county positivity rate is 14.3%. For negative test results, we've had 185,216. Unfortunately, we are adding an additional death today. That was a male in his 80s with unknown health conditions, bringing our county death total to 324. And our thoughts and prayers are with all the families of those who've lost their lives to this tragic virus. For those that have completed their IDPH required 10-day isolation period, we are at 18,838. For state totals, they have tested 13,178,017. For positive test results, 955,380, which is an increase of 7,374 from yesterday. Additionally, the state has added 178 new deaths since yesterday, bringing the statewide death total to 16,357. For our hospitalizations, as the chairman mentioned earlier, St. Clair County hospitals, today we have 122 COVID-19 related patients, and that is the highest number we have ever had for COVID-19 patients in St. Clair County hospitals since this pandemic began. Of those 122, 15 of them are on ventilators. Regionally, we have 203 COVID-19 related patients, of which 22 are on ventilators. For our congregate care facilities and outbreak status, those with changes today, the Freeburg Care Center has an increase of 11 cases, bringing their total to 64 cases and 2 deaths. Four Fountains in Belleville has an increase of 5 cases, bringing their total to 128 cases and 29 deaths. Integrity Healthcare of Belleville has an increase of 1 case, bringing their totals to 81 cases and 2 deaths. And finally, Sycamore Village in Swansea has an increase of 1 death, bringing their total to 22 cases and 1 death. As we've mentioned throughout the week, testing is available today until 4 o'clock at the St. Clair County Public Services Facility at 330 West Main. Tomorrow, we will have testing from 8 a.m. to 4 p.m. at the Clair Fairgrounds. Our testing sites will be closed on Friday, on New Year's Day, but reopening on Saturday will also be St. Clair Square and an additional testing 8 to 4 at the Clair Fairgrounds in Belleville. So I will now turn it over to Chairman Kern.
Thank you, Brian. We'll move into the zip code report. In 62201, we go up 1 today to 451. 62204 goes up 7 COVID positives today at 325. 62205 up 7 to 517. 62206 up 5 to 987. 62207 up 3 to 456. 62208 up 12 to 1179. 62220 up 25 to 1424. 62221 up 21 to 1,980. 62223 up 18 to 1,244. 62225 up 4 to 99. 62226 up 36 to 2,257. 62232 up 6 to 673. 62239 up 2 to 319. 62240 up 1 to 104. 62243 up 12 to 493. 62254 up 2 to 603. 62255 up 1 to 56. 62257 up 3 to 233. 62258 up 8 to 745. 62260 up 5 to 513. 62264 up 4 to 245. 62269 up 46 today to 2,262. And 62289 up 1 to 37. 213 new positives today, with 1,491 people tested, brings our daily county positivity up to 14.3%. That brings our 7-day rolling average up to 12.8%. Regional positivity remains at 12.1% today, and all the counties that make up that region are Bond at 19.1%, Clinton 10.7%, Madison 24.3%, Monroe 11.7%, Randolph 8.3%, St. Clair's at 18% today, and Washington County's at 23.9%. So numbers continue to go up. Hospital deaths are continuing. People need to stay home and avoid crowds, avoid parties. Wear your mask, wash your hands, watch your social distance. As we heard from the doctors that joined us today, we're getting there. We've got this vaccine, so we just need to hang on, try to avoid spreading or being part of the spread of COVID till we get the vaccine, and then we can move back into our normal lives. But if the numbers remain high, it's only going to make it harder for us to be able to get where we need to go in a timely fashion.
Well, it still amazes me, these doctors take time out of their schedule to come on here. They have been periodically over the last 292 days. We've had numerous different physicians on here. And there are still people out there that don't want to listen. If the doctor tells you to do something, most of the time we do it, but they say stay home, wear your mask, wash your hands, watch your social distancing. It acts like they don't know what they're doing.
And they know that these fine hospitals that have been part of this program and that we're lucky enough to have in this county, if those people who are saying, well, we're not worried about this, they're not worried because they know that they've got fine hospitals that are going to take care of them. The amount of pressure that is on our doctors and our nurses and all of the staff and all the first responders during COVID-19, they're only increasing that stress by not doing what's being asked of them. They're creating these numbers that really we don't need to have. We don't need to have gatherings that are going to cause perhaps a super spreader incident. We're now hearing about this new strain of the virus. It hasn't shown up here yet in testing, but it's in the United States. It's in Colorado. If that strain comes here, it only makes matters worse. And these capacities there is no doubt that our capacities are being stretched in our care facilities, in our medical facilities, and we really need to just heed the warnings, do what's being asked, and we'll get there.
Well, and the hospitalizations, the last 24 hours went up 15 patients overnight here in St. Clair County, and that's COVID patients. That's not all the other type of illnesses and injuries that take place. So when we talk about capacity at our hospitals, that's what those hospital administrators are looking at. They're watching those numbers, needing those staff members to take care of all of the patients that come in, just not the COVID patients. And that's what we've been saying all of this time. Again today, 103 patients under the age of 40. So the age is there. New Year's Eve, tomorrow night, big night of the year for a lot of people, but I'm telling you, you need to stay home, and you heard the doctors, stay home and make plans for next year and celebrate that after this vaccine, after you get your vaccine. Hopefully we can all get back to some sense of normal, whatever that's going to be. But I can tell you right now, another death since yesterday. We're up to 324 here in St. Clair County, and some of you say, okay, that's 260,000 population, that's a small part. One death is too many. 16,357 across the state of Illinois. That's the size of some small communities. So stop and think about that. One death too many. So we'll be back tomorrow afternoon for day 293. Boy, they just keep rolling in here. And we'll have more numbers for you, and we'll be back with Daisy in a few moments to translate this into our Spanish communities. So everybody, please, we got to get these numbers going down. Have a good evening.
One of the ways we can combat widespread infection is testing. It's been proven time and time again that many people who were infected with COVID-19 are asymptomatic, showing no signs of infection. They unknowingly spread the virus to those most vulnerable in our community. Working together with health departments in our region, free testing has been made available throughout the area, and we encourage all citizens and visitors to take advantage of this opportunity. To Team St. Clair and the rest of Region 4, if we work together, we can and will stop the spread of COVID-19.
Buenas tardes y gracias por acompañarnos una tarde más. Antes de comenzar, quiero comentarle que hoy tuvieron una llamada vía video con dos doctores de St. Elizabeth, Dr. Schaefer y Dr. McGowan, que comentaron sobre su experiencia con la vacuna de COVID-19 y para recordarnos que no es un cura contra el COVID, sino que es prevención y nos urge a todos que hagamos nuestra propia investigación sobre los efectos y que aún nos tenemos que cuidar. ¿Ok? Y paso con los números del condado y del estado. Estamos a 205,878 exámenes que se han conducido. Esto incluye un incremento de 1,491 del día de ayer y 20,662 casos positivos, que incluye 213 nuevos casos de hombres y mujeres en las edades de menos de 1 año a 90 años. 185,216 casos negativos y 324 muertes, que tristemente incluye una nueva muerte de un hombre de 80 años que no tenía problemas de salud previos. 18,838 es el número de personas que obtuvieron un resultado positivo y que han completado los 10 días de aislamiento requeridos por el Departamento de Salud. Los números estatales son de 13,178,017 exámenes que se han conducido a través del estado y 955,380 casos positivos, que incluye 7,374 nuevos casos en el estado y 16,357 muertes, que tristemente incluye 178 muertes en el estado. Hasta el día hay 122 personas hospitalizadas por problemas relacionados con COVID-19 y 15 de ellos están en ventiladores. En la región hay 203 hospitalizados y 22 de ellos están en ventiladores. En las instalaciones de cuidado a largo plazo hubo 4 cambios. En Freeburg Care Center aumentó con 11 casos. Four Fountains aumentó con 5 casos. Integrity Healthcare de Belleville aumentó con 1 caso. Y Sycamore Village de Swansea tristemente aumentó con 1 muerte. Mark Herner, director de condado, estuvo con nosotros hoy anunciando el número de casos por código postal y hoy solo le voy a mencionar los que tuvieron un aumento. 62201 aumentó con 1 caso. 62204 aumentó con 7 casos. 62205 aumentó con 7 casos. 62206 aumentó con 5 casos. 62207 aumentó con 3 casos. 62208 aumentó con 12 casos. 62220 aumentó con 25 casos. 62221 aumentó con 21 casos. 62223 aumentó con 18 casos. 62225 aumentó con 4 casos. 62226 aumentó con 36 casos. 62232 aumentó con 6 casos. 62239 aumentó con 2 casos. 62240 aumentó con 1 caso. 62243 aumentó con 12 casos. 62254 aumentó con 2 casos. 62255 aumentó con 1 caso. 62257 aumentó con 3 casos. 62258 aumentó con 8 casos. 62260 aumentó con 5 casos. 62264 aumentó con 4 casos. 62269 aumentó con 46 casos y 62289 aumentó con 1 caso. Y finalmente, Eric Simmons estuvo con nosotros hoy y nos comentó que estamos a 14,3% de casos positivos en el condado y en la región estamos a 12,1% de casos positivos. Muchas gracias y nos vemos mañana.